huge. You've got to take the kids out of the room right now, or you may want to, you may not want to. Veterans with post-traumatic stress disorder experience high rates of sexual dysfunction. So, but few are aware of available treatments. And so there's available treatments for veterans, and this is all new information to me too. Dr. Irwin Goldstein, Director of Sexual Medicine, Alvarado Hospital, is here to explain. Where do we start with this?
So, taking 2 steps backwards, the Journal of Sexual Medicine, our journal, reported a new paper, Sexual Dysfunction in Veterans with Post-Traumatic Stress Disorder. It's a review of 40 manuscripts or more that have looked at hundreds of thousands of veterans with post-traumatic stress disorder. So there's a bunch of key findings and a bunch of recommendations, and I just want to share from this article.
Yes.
So first of all, at the La Jolla VA, we actually have a sexual medicine clinic. It's called Goldstein's Clinic. You go through urology, but it would be our honor to work with any veteran, male or female, who has a sexual health issue, because we are ready to work with them, and we'll talk about that. Okay. The first key finding is prevalence. They show that 8.5 out of 10 men, 85% of men who have PTSD, who's a veteran, has erectile dysfunction. That's an unbelievable amount of
what about
condition.
Women?
So for women, they have 40% of women who have post-traumatic stress disorder have pain during sexual activity.
Wow.
That's an enormous number.
In the regular population, how many percentage have?
Yeah, it's far less than that.
Okay.
It's like 25% or so,
Okay.
or even less.
Okay.
The other issue is cause. Post-traumatic stress disorder is usually combat, but for women, it's called military sexual trauma. It's actually not even combat, but it's while they're active duty. They get sexually harassed, sexually abused, raped, and their PTSD is responsible from that point of view.
Or it could be both.
Or it could be both. Psychologically, there's horrible emotional numbness, there's low self-esteem, there's disgust, there's anger, there's hostility, there's guilt. All of these things need to be addressed. But one of the other findings of the paper is there's huge numbers of biologic issues that are not being ignored, that are being ignored. They're not being sort of dealt with because everybody's focused on the psychology of all of this stuff. So when you have depression, you're put on depressive medicines. When you have anxiety, you're put on those medicines. When you have psychological issues, you put on antipsychotic medicines. These are not sex-friendly drugs. So a large part of their problem is in trying to help them psychologically with medications.
They end up causing a second or third order problem.
Right. And people who have depression and people who are veterans often have cardiovascular problems like hypertension, high cholesterol.
And that can cause sex problems?
They don't eat well. Yeah, of course.
Okay.
I mean,
I'm not the doctor.
Yeah,
I don't. Yeah.
Cardiovascular issues reduce blood flow to various parts of the body, including the genital.
What about just general low interest for women especially? They're just not interested.
Yeah, so the traditional concept in PTSD is that's a psychological issue. They have numbness and they have relationship issues, low self-esteem. But I have to tell you, they really have to be assessed biologically. Those women have huge problems with hormones. They're often on medications to prevent pregnancy, and those medications, as we've discussed in many of these previous shows, affect hormones.
And women especially are quite complex, and you need to spend a little extra time with them, and I know that you do this. I did not realize this about Dr. Goldstein, but he like you just mentioned, on Thursdays.
Thursday mornings, tomorrow, we will be doing this.
On his own dime, goes to the VA and heads up a clinic there that's not called the Sexual Dysfunction Clinic. It's called Goldstein's Clinic.
Yeah, they won't let me
This is huge
call
news. You also have a charity golf tournament benefit that benefits Iraq and Afghanistan Veterans of America, which is Friday, March 27th from 1 to 5:30 at the Riverwalk Golf Club. So I highly recommend that you go there, maybe send some money to help out. I mean, you know, it's our turn to help them. You know, they helped us.
It really is, yes.
You know, for sure. For more information on Dr. Goldstein or anything, because we haven't even touched on the topic of active duty. right, Erica? So for more information, go to our website, and we'll get you in touch with Dr. Goldstein or the nonprofit organization, and hopefully another time we can talk about
active. We take care of active duty. We do great with them. And
at your private practice.
At our private practice.
Okay.
It's
a huge deal.
It's a huge problem.
It's a huge deal. Yeah. I know. And thank you very much for all that you do. Erica, we're going to send it back over with you.
Interesting stuff, Christy. Dr. Goldstein was here in my book, and now he's here. You just went a notch higher. Wow.